I am the Director of Public Policy and Advocacy for the Alzheimer's Association Mass New Hampshire chapter. New to this role, although I have spent the last 2 years with the association. And yeah, it's been a great experience so far, serving many families in need. Obviously, some of you, or probably all of you, are very familiar with those needs. And just want to say thank you to Kelly for inviting me here to meet you all this morning, and yeah, just to spend some time together. I am going to share slides just because it's easier for me to organize myself, and a little easier with bill numbers and data and things like that. But obviously this is casual group, and feel free to ask questions or chat or things like that, or I can take some questions after. I don't promise to have all the answers, considering I am new, and also our federal agenda is quite new, including a bill that just got bill numbers last week. so bear with me on that, but we'll do the best we can here. So let me just share my screen give me 1 second. Let's see if this cooperates. I just got a new computer because my last computer hated me. So we will hope to be doing better.
And here. Chelsea, I'll go ahead and manage any of the chat questions that come in case you want to just focus on the presentation. I'll ping you if I'll interject if somebody has a question.
Oh, well, we might have a little bit of a problem here, actually. Let's see. Sorry. I like to just start real quickly with just some very basic overview of like why the Alzheimer's Association even engages in advocacy and policy work. I think maybe you won't all be given your work, but some people are surprised to learn that we're so active in the policy arena. And so we like to just kind of explain to people that for us, we see, or really we know and understand that Alzheimer's is unfortunately a large-scale public health crisis. And it's become a little easier to explain to people why we're engaging in policy work. I think a lot of times, especially when it comes to nonprofits, people are like, stay out of politics, just focus on the families or focus on research funding, which are huge focuses for us, as you know. But policy is also a huge focus. And that's really because we understand, especially from looking at COVID-19, that if you want to move the needle in a large way and really address a large-scale public health crisis, you really need leadership front and center, and you need policy change, and you need federal dollars and funding. And I mean, if you think about it, COVID-19 obviously has been devastating to everyone, but it has also shown that we are capable of collaboration and research, at least to some extent, and large scale investment when large scale public health crisis is taken seriously. So obviously there's a lot of priorities out there in policy, and we're just trying to raise awareness and make sure that of all those issues that our lawmakers are considering every day, they remember about people with Alzheimer's and dementia, especially because, as you all clearly know from your work or personal experiences, not all of our population that we represent can really advocate for themselves. So we have to be that voice for them and make sure that we are communicating that to lawmakers. So I'm going to share a little bit of data, and then I'm going to go into more about some of the policy work we've been doing. As we just kind of did a round of data collection that I thought you all might find interesting. I know, 8:30 in the morning, I'm like, data is interesting, but I promise I even have a video. I will make it interesting. So I like to share this slide just initially of it's a little outdated, and I have more current data from our recent round of 2021 data collection. But I do love this visual, well, love-hate relationship with it, of like where we are and then where we're headed. And this is top of mind for any policy staff at the Alzheimer's Association of, right now, we're actually around 6 million people living with Alzheimer's and dementia. And just seeing that unfortunate growth by 2050, both in terms of that top line is the projected number of people living with the disease, excuse me, and then the bottom is projections for cost, and that's just in the United States, which is really, really it's an unsustainable strain on our healthcare system, obviously on families, on communities, state budgets, federal budgets. We cannot do 1 trillion a year on one disease. And obviously that also means that there's been devastating impacts on families and individuals and communities if we're getting to that extent. And I'll get into the cost a little bit more in a bit. This is our recent report. It's long. There will not be a quiz, but for anyone who's interested, or if it's helpful in your work, some people like to share this as a resource. You can find it at alz.org/facts. And I'm sure Kelly or I could send that out as well later, but there's also a very interesting special report where we looked at the issue of race, ethnicity, and issues of diversity in this issue of Alzheimer's disease facts and figures 2021, that some people, especially people in the field, have liked to refer to and learn from, as some of this research is kind of new, a new focus. Not totally new. We've known for a long time that this disease unfortunately impacts people of color at a greater rate than white people, but we did dive in a little bit further into how families feel about that and how they feel about the healthcare system and things like that. So it's pretty interesting. I'm going to play this quick video here. Let me know if you can't hear the sound, although you don't absolutely have to hear it. Okay, hopefully that worked for all of you. Kelly, were you all able to see that?
Yes, thank you. Okay. That was great.
We're doing real well if I was able to play a video for you all. Okay, awesome. Oh, no, it's just gonna keep going. Let's see, hold on. Okay, sorry about that. I'll just touch on a few more things and then we'll get into the policies, but just to give a full picture of where we're at with Alzheimer's and dementia in the United States. So we know that over 6 million Americans are living with Alzheimer's and other dementia. And we also know this number is low, one, because it's underdiagnosed, underreported, and also it's very hard to collect data on those with younger onset. So just full disclosure on that. 6 million is still way too high. And it gives us a jumping off point, but it is not, I wouldn't say it's a complete picture of how things are. And then we know
Chelsea,
that.
Can I ask one question on that data?
Yeah.
Is it specific to Alzheimer's, or is it more just dementia, the broad brush of dementia?
So this number in particular is Alzheimer's, and then a few other like it wouldn't be like mild cognitive impairment or things like that, which are not technically classified yet, but like if you have vascular dementia, let's say, you would be in this category.
Okay, and what about like the Lewy bodies and those as well? Okay, that
Yeah. Yeah.
Thank you.
And I can double check like what the list incorporates, but I'm almost positive that like FTD, Lewy body, vascular get looped into with Alzheimer's, because the Alzheimer's Association also, technically represents those populations as well. We just, the name would have been way too long for a nonprofit, I mean. But yeah, let me double check that, but I'm almost positive that that number is inclusive of those as well.
Okay, thanks.
Yeah, of course. And yeah, sorry, this recently came out as well, so I haven't sat with the data too long. Yeah, and then I think I mentioned this earlier, but Black and Hispanic Americans are more likely to have dementia than white Americans. For our Black community, it's almost 2 times as likely as a white American to have Alzheimer's, and then Hispanic Americans, it's about 1.5 times the rate as a white American, which often people are surprised to learn. So this is just a little bit about mortality. As you all know, Alzheimer's disease is fatal, unfortunately, and it is progressive. But there are many who die of something else, and they die with Alzheimer's or other dementia. While we're looking at mortality, this is something we are looking at right now. We can get into this a little bit, but we know the effects of COVID-19 have just been devastating on our population for many reasons. Devastating for caregivers, for the workforce, anyone who works with those with Alzheimer's and dementia. Obviously, in long-term care facilities, this was just a horrible tragedy. But we are starting to get some data that concerns us around, this is not a number of people with Alzheimer's or other dementia who, then had COVID and have COVID-19 on their death certificate. This is just a number of the amount of increase of deaths with people with Alzheimer's or other dementia on their death certificate. So there's a lot of thoughts around this. Don't take all these with a big grain of salt, because this, we have this number, but we don't have the scientific why. But there are some theories in the community around the impacts of isolation, of individuals or families delaying medical care out of fear, keeping loved ones home, and then also it's definitely, obviously, if you see that big jump in March and April, it's very possible that they were, it was classified as that on their death certificate, and potentially the healthcare professionals did not know what they were looking at. Yeah, just something to be aware of. I know all of you, obviously, some of you doing this work this past year are aware how devastating COVID has been to this population. We've had a lot of concerns around access to services, isolation, caregivers having no resources or supports, adult day being closed, all sorts of things. But this is just like another terrible impact that we will be continuing to take a look at, in case you want to stay aware of this. This is just a little bit more about the costs. Obviously, you saw that graph going up till 2050. But it's obviously already way too expensive. Before COVID-19, we actually were the most expensive disease in America. We have stopped saying that because we are fairly confident COVID-19 has taken that unfortunate title. So it's still way too expensive, and will continue to be way too expensive for, obviously, private and public dollars. We just talked about this, that, it's expected to rise, and it's a huge strain on Medicare and Medicaid. So this is a little bit just, I would say if we do send around the report, the special report is piece of it is not that long, and I find it very interesting, but definitely just spoke to some distrust from people of color in the healthcare system, and in also lack of trust in participating in clinical trials, which is obviously a big concern to organizations like ours, because if Alzheimer's and other dementia impact, Black Americans at twice the rate, we want to make sure that we, have that population in clinical trials represented. And that has been a big struggle in the research community, is to get diverse participants. So yeah, I highly recommend this. I won't go into everything, but they did collect some very interesting data here on just, stigma and discrimination and different views held by different populations, basically. Let's see, here we go. Okay. So what are we doing about all of this? Clearly, a lot of those numbers are overwhelming. So as you can see from here, one of our biggest priorities always at the Alzheimer's Association is to advocate for research funding at the National Institutes of Health, specifically dedicated to Alzheimer's, and it's classified as related dementia research there. So, when we started really kind of innovating and pushing hard on the advocacy front around 2010, that's when the National Alzheimer's Project Act was crafted and signed into law by President Obama, for anyone who is familiar. So you'll see at 2011, we were under 500 million, and we were really excited that just this past year, during COVID-19, we were actually, we were praying for, we were pushing for this number, but, we were realistic to know that with COVID, we might not get the increase in funding that we felt like we needed, and we did get it. So we are now at over 3 billion. Sorry, my voice is going out. Okay. $3 billion for research funding. So we were really happy about that. And I'll also just say, from an advocacy perspective, this is a dramatic rise in federal funding dollars in a relatively, short time frame. And really this graph to us as policy staff and as association staff or members of this community are just like, it's proof to us that our advocacy work works, because this is something that we push really hard for every.
No, I'm on a call.
Okay, so on that note, just a little bit of a look back just on the past year. We won't go back too far, but we did have some successes recently on the policy front. Again, we were thrilled, just considering everything else going on for Washington, D.C., that we were able to have any sort of success, to be totally honest. And so we had the Promoting Alzheimer's Awareness to Prevent Elder Abuse Act signed into law. And then there's, a massive bill every year around funding. And in that, we also were able to secure language that had been a bill we were pushing called the Improving Hope for Alzheimer's Act. So both of these bills, so one, the Elder Abuse Act is basically just directing the Department of Justice to develop some training around elder abuse, some materials around it that, law enforcement and different individuals are able to access, and to hopefully bring attention to that, and also some resources. The Improving Hope for Alzheimer's Act, I don't know if any of you are familiar with this, but there was a law passed years ago that we pushed called the Hope for Alzheimer's Act, which basically secured care planning as a benefit under Medicare. The problem is that no one used it or knew about it. So it was used at like a rate of like 1%, and I might be being generous there. So the Improving Hope for Alzheimer's Act actually asks Medicare, or directs Medicare to basically bring awareness to this benefit, to promote it, to send communication to physicians and other people, and we're hoping to see those rates rise. And then we talked about this a little bit, but a huge focus since March 2020 has been for many organizations, has just been responding to COVID-19. Obviously, we've been concerned, as I already talked about the impacts on our population. So last spring, we really lobbied hard for things like PPE and testing and funding for especially long-term care facilities. Usually we leave that up to their own lobbyists, but just given the impact and what was going on our population, who, in long-term care facilities, usually around 50% of the residents will have some form of dementia. So we felt it was really important for us to get involved and help secure funding and resources. And then we also pushed for things like vaccine prioritization, both for the long-term care community, including staff, and then also for anyone with dementia, and then family caregivers as we got later into vaccination phases. So that's just a little bit of a look back. And then to talk about some of our current appropriations and other requests right now to the federal government. As always, we are always pushing for that number for Alzheimer's research at the National Institutes of Health. Something interesting that you all might find about this, like how we come up with this number, of like what is needed, is so I spoke about how briefly that the National Alzheimer's Project Act passed actually right around a decade ago. And in that plan, it was established that as a goal that by 2025, there would be a disease modifying treatment, along with some other, research advances like, substantial progress on prevention and things like that. So, when we looked at that goal, it was kind of like, okay, great, like we would love that. How do we get there? And obviously we feel the way to get there is through research. And what we did is we actually have asked the NIH, formally through congressional action, to come up with something called the NIH bypass budget, that scientists sit down and look at, okay, if we want to meet this 2025 goal, how much money do we need? Because we're not expert, we can go ask for the money on Capitol Hill. We know how to do that, but we are not experts on, like what would be an appropriate increase year to year that they could use. So it's been really, really helpful. And it's also been helpful in our advocacy efforts to be able to point to, like, this is what the scientists say that they need to be able to push forward on this 2025 goal. So this year, the number we're asking for is exactly what scientists at the National Institutes of Health have asked for. So they've asked for an increase of $289 million on top of that $3.1 billion they were just left off with. They say that, and they even, getting a little into the weeds, but they even lay that out in a whole document of what exactly, they would focus that additional money on and things like that. It's like a 50-page document. If you if you want to look at it, I can send it to you. But yeah, that's been a huge kind of tool in our toolbox of using that bypass budget that they put together every year now for us, or really for Congress, that we then push for. And then I don't know if any of you are familiar, but we do have a second appropriations request that we push for. And this year it's $20 million. So the Bold Infrastructure for Alzheimer's Act passed in 2018. It had a huge amount of bipartisan support. I'll just go to the next slide real quick. Sorry about that. So this act passed in Congress, and in 2018, it laid out funding for authorized $100 million over 5 years. So 20 million a year. You would think, although Congress likes to do its own thing with how they then appropriate funding, but basically saying you can spend this money. It doesn't mean they will, which is something that trips people up. And basically what this law does, assuming we get the funding, is that through the CDC, it sets up this public health infrastructure kind of like vision for Alzheimer's and other dementia. So we know that we need more public health infrastructure around Alzheimer's and other dementia. So the CDC would then administer grants to public health departments. It establishes Alzheimer's Centers of Excellence, which are looking at things like early intervention, diagnosis, as that's such an issue with Alzheimer's, is just the underdiagnosis rates. It increases data and timely reporting, which also helps with all sorts of things in terms of resources and research and things like that. So we have gotten funding for this. The first year we got 10 million, last year we got 15 million, and this year we're really pushing hard for that full 20 million of funding. So that hopefully the CDC can give out more grants to public health departments across the country, potentially set up other Alzheimer's Centers of Excellence. And yeah, so this is a big priority for us, as well as to get CDC the funding it needs to make sure we have a good infrastructure around Alzheimer's. Okay, so this is a new priority for us. It's called the Alzheimer's Caregiver Support Act. And it would provide grants to organizations to expand training and other support services to family caregivers. So, we are hopeful that these services would then obviously enhance quality of life, both for the individual living with the disease and also for the family caregiver. I know many of you are familiar that it's really, really hard work. There's really high, there's a lot of concerning data around how family caregivers are doing right now, some of which we actually just collected in that 2021 report. And I think I have a slide or two speaking to that. But also I think COVID-19 has really shed a light, not just for us, for many organizations, for many families, communities, state governments, and also members of Congress around, they were getting constituent calls all day, all night during this time period of, caregivers were struggling before, but what happens when, let's say, if I'm a caregiver and a close family or friend is usually my backup and we're social distancing, like, as you all know, and probably have seen scenarios like this play out through your own lives, like, what happens? What's your backup plan if you get COVID? What's your backup plan if you can't lean on other family or friends, or senior centers are closed, or adult day, or some other service that you might really use as a lifeline? I've gone through Alzheimer's and other dementia in my family, and I can speak to several times, but my aunt, for example, she unfortunately had younger onset, passed away from it. But adult day was a real lifeline for my uncle, who provided amazing care for her. But thinking of what do you do when all those sorts of services are stripped away is really, really difficult. So we're hoping to move this forward. We have gotten some great support for it so far. It's a bipartisan piece of legislation, as you can see. We have a Democrat and Republican in both the House and Senate leading on this, and have recognized that this is an important important thing to move forward. You all might, I think one or two or a few of you said you do some work in Maine, so obviously you might recognize Senator Collins there. So we're excited about this and the momentum it's building. I kind of just touched on this a little bit, but to give you a little bit more of the actual numbers, this is a question I get a lot, is that is this just like kind of general caregivers, like for family caregivers across America? This is actually, unfortunately, there's a lot of people struggling, because this is just the 11 million caregivers are just people caring for someone with Alzheimer's or other dementia, like vascular or FTD or things like that. So that's worrisome in itself. But the Alzheimer's Association, we have all sorts of programs and services, and we try to be there and have training programs and resources and support groups and services for especially family caregivers. Unfortunately, we are not scaled to provide extensive care and training to over 11 million people and growing. So we're excited about this, that this would hopefully be an opportunity for other organizations, even government agencies, to expand some of those services and make sure we aren't having people fall through the cracks who might need that. And then one other thing, that we have been, just speaking to in conversations with members of Congress and their staff about this, because I think if you haven't seen it up close in your professional or personal life, sometimes it's like, well, why does it need to just be an Alzheimer's caregiver focus, whether it's this bill or talking about other things. And as some of you might know, caregiving for someone living with dementia is very different, and these people have different needs. So just for example, twice as many caregivers of those with dementia indicate substantial financial, emotional, and physical difficulties compared with caregivers of people without dementia. They are also at higher rates having issues with their own personal health. At higher rates, they're caregiving for longer because of the length of time of this disease. And then they are also often helping more extensively with things like, personal grooming and other just kind of day-to-day tasks that can be really intensive and straining both, on them physically and probably emotionally as well. So that's why we feel it's really important to have some, dedicated federal resources to specifically help these caregivers. Okay, so that we're almost through. I promise I'll stop talking at you all soon. That brings us to a brand new piece of legislation, and bear with me because we really literally just filed this. Actually, Kelly and I have been talking about for a while if it was going to be filed and things like that. So it is filed. It's called the Comprehensive Care for Alzheimer's Act. And we're really excited about it. It's brand new to the association. And I'm going to start with another quick video so you get a break from me talking. And then I'll just explain what that is. just a little intro video for you all. So we're really excited about this. This is something that we have been looking at for really years. So basically what this bill does is the Comprehensive Care for Alzheimer's Act asks the Centers for Medicare and Medicaid Innovation, so CMMI, as you see on the slide, to test a better payment structure for dementia care management. So the idea of this is that Congress would pass the bill, which would basically formally ask CMMI to do this, and then CMMI would test the effectiveness of this dementia care model system that we have laid out through the bill. And just to be clear, this would not be like rolled out everywhere right away, and like how you pay for dementia care would be revolutionized. This would just, it's really asking CMMI to test a model and to test, basically think of it like they would roll out a pilot, let's say. So this is something that has been on a very small scale tested through a few healthcare systems, and we did see good results. There was one at UCLA and a few other healthcare systems where they enrolled families, and that they would basically deliver services and then therefore deliver payments, and kind of like instead of as individual services, as like a monthly payment. And they would be evaluated on certain quality measures, as opposed to everything being individualized of like, okay, like the patient needs this, we'll do this. It was more like, let's take a step back and treat the patient, and also take the family caregiver into account. So there's a lot of focus in this, which is really quite different, obviously, than just looking at the patient, of also looking at their primary family caregiver. Obviously, not every single person has that, but for those that do, it's really important to evaluate outcomes for them and the whole family as well. So as I said, this legislation was based on a few real life studies that have been done, and it's a very small scale, but there were good results that showed reduced hospitalization rates, sometimes delayed need for long-term care placement, and then also reduced overall costs for the family. So obviously, those are things that the association, wants for our families, and we've been looking for a way to do that, and to make sure that we don't lose any quality of care, while also trying to find ways to reduce costs, which is always a very difficult thing in healthcare. So when some of these studies ran in healthcare systems, we then convened basically a work group through the association to discuss, how to move forward with this. Let me just go to the next slide here. Again, it seems like many of you obviously work in this world or close to this world, so that care can be very complicated for the individual living with the disease and their family. Things can be very individualized in terms of healthcare, and we're really trying to see if there's a way to bring those things together a little bit more and make it a little bit easier on the family. So how this would work, would this be, at this point, this would not be, just to be clear, like for healthcare plans. This would be for like through Medicare, and it would be provider payments would be per patient per month. And it would be, based on several services they're providing. And then also there would be bonus payments depending on quality measures for and outcomes for the patient and family. So it's a little
Kelsey,
bit.
can I ask a question on
Yeah.
that? Does it, for this sort of model to start, does it require the person to have a diagnosis first?
Yeah, you would have to have
Okay.
a diagnosis. That's a really good question. Yeah, that's a really good question. It's something we've actually, our team in our DC office has thought about, but there wouldn't be really a way for us to qualify people without that diagnosis, which is one of the reasons that we're so passionate about funding for the CDC, because they are working on how to increase diagnosis rates. Yeah, that's a great question. So this is just some like key elements of the framework laid out in the bill around on the key elements side of this, around things we were kind of looking for through the work group of like, how do we bring all these things together and potentially have them paid for. And then on the right side, you'll see there services as well. Some of these services are already, already things that people have access to, but again, they might not be so easy to access together, if that makes sense. So we're trying to really push out this framework of, put all of this together and test how it works for families, and if care improves and costs go down. And the idea too is, we know sometimes things like this can be extensive in terms of, what we're asking providers for, or things like that. But the idea is that the cost would go down, public and private dollar wise, because hopefully things like hospitalization, emergency room visits, and if the family wants a delay of long-term care, if they get better care up front and more coordinated help. I spoke a little bit a minute ago about quality measures that would be looked at through this payment structure. So, as I just said, we'd be looking for, ED visits to be down, inpatient hospitalizations to be down. And then we'd be looking for some of these other tools and supports to be in place. And then also testing out, what happens if we kind of include the caregiver more in the care themselves for this patient, and look at outcomes for them as well, which are the bottom two there. So just see. Okay, yeah. So, at this point, this is just like a bill for a pilot. We are very hopeful about the appetite to test this at CMMI. And just in case, for those who don't know, CMMI, I don't know if I said this, this is all they do. So they test, they take a look at and test innovative healthcare models for, whether because they think they'll improve outcomes or reduce costs or both. So this is exactly what they do. And then if there's a lot of success, then there's potential that it would roll into Medicare or Medicaid, depending what the healthcare model is. These are our bill sponsors. Again, we're looking for everything the association does. We're always looking for bipartisan support. And same for our House bill sponsors. And we're really excited about these sponsors as we were able to select sponsors here who, like, we believe the bill will run through their committees. So we're hopeful about their leadership on this. This is getting a little into the weeds. We don't really need to get into this, but basically, a question we get a lot is like, how is this different from the Alzheimer's Caregiver Support Act or the, Hope for Alzheimer's Act? The Alzheimer's Caregiver Support Act would provide grants to communities to help family caregivers. This is really quite different legislation around changing, hopefully changing payment structure for those with dementia in the Medicare system specifically. And the Improving Hope for Alzheimer's Act is asking Medicare to distribute information around the Medicare benefit. And right now, just to be clear, it is still a fee for service model. So we still want to make sure we're getting communication out there about, about the care planning benefit that is currently covered by Medicare, and we'll continue to work through all systems that impact our population. Another question we get a lot is like, how does funding work? As I said, this is a brand new bill, so we haven't gotten there with the sponsors yet. I'm sure that will obviously be looked at, but we're not there yet with this particular piece of legislation. So that kind of covers it for our current legislative priorities. I know, especially at the end, I was getting really into the weeds on that. You guys were my first test group, sorry, of trying to explain that piece of legislation. So thank you for bearing with me. I'm sure it will, I'll come back in a few months. I'll do it much more briefly. And I just wanted to bring your attention to, we do have something called the forum that we have every year. Usually it's in Washington, D.C., but this year it's actually a great opportunity if you know people who might want to participate or learn more about any of these types of things. You can go to alz.org/forum. It's May 17th through 19th with really a primary event on May 19th at 7 p.m. with all sorts of members of Congress and other interesting speakers participating. And all of these priorities will probably be at least touched on a lot more briefly. And then there's also actually an opportunity to participate in meetings virtually with your members of Congress, May 17th through 18th. No advocacy experience is necessary. They're quick meetings, and as long as you have an introduction, you are more than welcome to join. So I will make sure Kelly has that link as well for you all. This is just an overview of basically what I just said. There's actually a policy briefing tonight, May 4th at 7 p.m. If you all decide you want to learn even more than what you just did. And then, I'll make sure Kelly has all of these action steps as well in my email. But I appreciate you all listening. And if you have questions now or in the future, I'll again make sure Kelly has my email. Thank you again to Kelly for inviting me, and I will give you back your meeting here.